Well, tonight, the Vermont NAACP and a group of state lawmakers are calling for every incarcerated Vermonter to be immediately vaccinated. This as COVID-19 continues to spread among staff and inmates at Northern State Correctional. The latest round of testing identified a dozen more positive cases, and that brings the total from this outbreak now to 181. State House reporter Devin Bates is live in Montpelier tonight with more on the push for prioritization. Devin?
Well, Lauren, in a letter to Governor Phil Scott, 17 state lawmakers, including the entirety of the House Progressive Caucus, said that the outbreak at Northern Correctional should be reason enough for the state to change its vaccination playbook and protect a population that many feel are vulnerable and forgotten.
I think it's a really important moment here where we either consider incarcerated Vermonters part of our community or not. That is the ultimate definition of a vulnerable population. When they cannot move, they cannot escape this virus coming in with new incarcerated individuals coming into the facility.
The outbreak at Northern State Correctional Facility in Newport dates all the way back to February 23rd. It spread rapidly in that first week, impacting well over 100 inmates and staff members by March 2nd. At the time, DOC Commissioner Jim Baker said, quote, "Northern State is now being treated like a hospital."
The bottom line is we're not paying enough attention to the system. And now that we are paying attention to it, we're seeing what's going on. We're seeing the discrepancies, and we're saying that there needs to be prioritization so that this doesn't keep happening.
Stefan Gillum is president of the Wyndham branch of the Vermont NAACP, which has been at the forefront of the push to get incarcerated Vermonters their doses. A 2016 report by the Sentencing Project found that 1 in 14 black Vermonters were incarcerated, one of the highest rates in the nation. Rutland branch president Mia Schultz said a massive outbreak shouldn't have been the starting point for a conversation in Montpelier about prioritizing inmates.
It should be noted that we always have to be the ones to stand up. We actually didn't even discuss any of that with legislators. We were just like, because of who we are and who we represent, we needed to make a statement. The governor never responded to us directly.
CDC recommendations call for prioritizing incarcerated people and workers in correctional settings. And State Rep Taylor Small of Winooski said a lot of the work done by the Vermont Department of Health should be applauded, but there's always more to advocate for.
I think we have done an amazing job with the little resources, especially in the beginning, that we had to work with, and that this is just the way that we work more collaboratively, is pushing for who are we leaving out in this process, and how do we come back together to reevaluate and make sure we are doing the best for our communities.
I reached out to the governor's office about this, and Press Secretary Jason Malucci sent me a statement saying in part, quote, "As the governor and state officials have repeatedly said, the primary objective of Vermont's vaccine strategy is the preservation of life, and the science and data clearly show that age is the top risk factor. That's why we've taken an age-banding approach, which has included inmates who are eligible in accordance with the state's vaccination phases." And as of now, as we've been telling you, the plan is to have every Vermonter eligible by the end of April, and that would include incarcerated Vermonters. Live in Montpelier, Devin Bates, Local 22 News.